Hello all, welcome to PharmaNandan. In this video, we are going to discuss the part 2 of pharmacotherapy of gout. For gout part 1, you can scroll through the YouTube link, right? Going into the topic, this is part 2, right? So, what is the treatment of the gout? We have seen there are many aims of treatment of gout, there are many lines of treatment of gout, right? So, in this video, we are going to study first what are the treatment options which we use for the relief of inflammation and pain. For the relief of inflammation and pain, there are three agents. First one is NSAIDs, second one is colchicine, third one is steroids. Right? In this slide, we are studying NSAIDs. Okay, what are NSAIDs with respect to gout? NSAIDs are first line of drugs for the pain and inflammation relief in the gout, right? What are the list of NSAIDs which are commonly used in the treatment of gout? Yes, the common NSAIDs we know. Paracetamol is used in the gout, right? And other NSAIDs, indomethacin is used, right? And what more? Yes, Sulindac is used, and Etodolac, and there are some propionic acid derivatives. All these are commonly used in the treatment of gout. Okay, what comes under these propionic acid derivatives? We know the list, right? This ibuprofen, naproxen, flurbiprofen, phenoprofen, right? What are the other things? Yes, ketoprofen and oxyprocin, right? Among these drugs, there is an interesting point which we should learn about this etodolac, right? What is the thing we should know about this etodolac? Etodolac has one more special property along with anti-inflammatory, that additional property of uricosuric property, right? And next, one more thing which we should learn about NSAIDs is the common NSAIDs which we may think of is aspirin. Whether this aspirin is used or not in the gout? No. Why? Aspirin is not preferred in gout because aspirin, because even low doses of aspirin, that is even small doses of aspirin, okay, they act as even small doses, they can block the effect of, if we use concomitantly these uricosuric agents, this aspirin will block it. Okay, that's why aspirin is usually avoided, right? What is the next line of treatment for the relief of inflammation and pain? First line is NSAIDs, right? That's what we have said, right? First line of drugs for pain and inflammation is NSAID. What is the second line for the pain and inflammation? Second line is colchicine. Okay, colchicine is second line of medication for pain and inflammation. So this might be asked as assertion reason question, like colchicine is colchicine is the second line of agent for the pain and inflammation in the gout. Why? This might be put in assertion. And what might be the reason? The reason they might provide is this colchicine has a property of very narrow therapeutic index, therapeutic window. Additionally, this colchicine has one more property. This colchicine has high rate of side effects. So that's why even though colchicine is highly effective, NSAIDs are given as first line, considering these side effects like high rate of side effects, and one more point, it has narrow therapeutic window. That's why colchicine is second line of agent for pain and inflammation. Okay, if it is given, then we can say here, yes, assertion is true, reason is true, and reason explains assertion, right? And what are the things which we should know about this colchicine? What is the mechanism of action of colchicine? Colchicine is having a property of it directly acts on the microtubules in the actively proliferating cells, like in bone marrow or neutrophils, which actively proliferate during infection or inflammation, right? So they target high rate of cell dividing, uh, high rate of divisions which occur in those particular cells. Okay, what happens to them? It binds with this microtubule and it interferes this microtubule for spindle formation, so that cells won't divide further and cell division is arrested at this G1 phase, and this has anti-mitotic activity, right? One more thing this colchicine does is, for example, this is a cell, this WBC, this secretes some cytokines, okay, this leukotrienes, some chemicals, right? Okay, and another neutrophil which is nearer, okay, these cytokines reach and give it signal and it will come to approach this earlier neutrophil, right? So cell signaling pathway, okay, so for this it has to release chemokines, right? Colchicine obstruct this chemokine release also, and for this movement of this neutrophil to this area, neutrophil has to move, right? Who decides the movement and the direction of the movement of neutrophils? These microtubules. Okay, these microtubules acts as cytoskeleton, just like they act as steering of our car while driving, right? It decides the direction where the cell should move. So when these microtubules are arrested, cell can't move and it can't go and it can't turn right to left or right any direction, right? So there will be a disturbance in the movement of the cells and the cytokine release and this chemotaxis. Overall inflammation will be relieved. And one more property is this calcicin reduces, I told you, neutrophil recruitment to the inflamed tissue site and neutrophil adhesion. Okay, and it alters the neutrophil motility. As I said, cytoskeleton is arrested, right? That microtubule part, and it decreases even the secretion of these chemotactic factors. Okay, one more interesting thing which colchicine can do is it even inhibits the release of histamine containing granules from these mast cells. Mast cells should release histamine, right? This release will be inhibited, right? And what are the uses of this colchicine? How does, what is the role when confined to the acute gout treatment in the by the colchicine? Okay, use. The main important thing with this colchicine, why it is highly popular in gout therapy, is it has this property of relieving pain dramatically. Okay, it dramatically relieves this pain in during acute attacks of gout. Okay, and if the patient has recurrent attacks, more frequent attacks, usually gout attacks we see, we make a record once in a year or once in a month, right? If a patient is having more track record of gout, that is of more frequency, okay, then what we should do? Ideally, this colchicine should be added with probenecid. This colchicine and probenecid together, where they are used in the treatment of, okay, frequent and recurrent, recurrent gout attacks. Okay, and one more thing which we should remember about this colchicine is colchicine, it is not removed during acute intoxication or chronic intoxication. It is not removed by hemodialysis. Got it? So what are the drugs which we use for this pain and inflammation? Number one, NSAIDs. Number two, colchicine. Number three, steroids. Like prednisone, we can give it as 30 mg to 50 mg as tablet therapy or per oral, and it can be tapered or it can be given directly as injection into intraarticular. Okay, and second group of drugs. What are those second group of drugs in gout? X. Xanthine oxidase inhibitors. What is the role of this xanthine oxidase? Who is xanthine oxidase? What is it? And why we are trying to inhibit it? Okay, let's learn about this one. In the purine metabolism, we see, right, there is one thing called during the by as products are formed in the cascade of reaction, hypoxanthine. Okay, this hypoxanthine is acted upon by an enzyme xanthine oxidase, and it because of it xanthine is released. Okay, what is the next product after xanthine? The same enzyme xanthine oxidase acts on xanthine. Okay, and then our main thing that uric acid is formed here. Okay, so what is our target in gout? We need to decrease the uric acid here, right? So to decrease the uric acid, so if I want to decrease the uric acid level, I can inhibit this enzyme, right? I can inhibit this enzyme, okay, competitively or non-competitively. So we developed some drugs which acts as inhibiting these enzymes. What are those drugs? Allopurinol. What is the thing exactly this allopurinol does? Allopurinol competitively it competes with this hypoxanthine, and it acts upon by the same enzyme xanthine oxidase. Okay, what happens? There will be another product called oxypurinol. Okay, what does this oxypurinol does? It again goes and binds with the xanthine oxidase. Okay, that is, the drug allopurinol binds with xanthine oxidase, and its end product after reaction with xanthine oxidase, oxypurinol is formed. Oxypurinol again binds to xanthine oxidase and inhibits it. Okay, there is double hit thing we can see here, right? And what is the nature of this allopurinol? How it acts competitively or non-competitively? It depends upon the dose. Okay, if allopurinol is given in low dose, it acts as competitive inhibitor of xanthine oxidase. Okay, if the same allopurinol is given in high dose, the same allopurinol when given in high dose, it acts as non-competitive inhibitor of xanthine oxidase enzyme. So whether it acts as competitive or non-competitive is decided by the dose, okay, of xanthine oxidase. Okay, By now we came to know the mechanism of action of allopurinol, right? So what are the main things which we should know about allopurinol? Number one point is, yes, it is first line of uric acid lowering therapy. Okay, we are trying to decrease uric acid production, right? So to decrease the uric acid production, okay, first line of uric acid lowering therapy, xanthine oxidase inhibitors. Among them, allopurinol is first agent of choice. Okay, next point is, it is used mainly keeping in mind one point, it facilitates. I told you in chronic gout we can see radiologically structures called tophi, right? To dissolve this tophi, allopurinol helps dissolution of tophi. When asked what is the most common anti what is the most common anti-hyperuricemic agent? Yes, allopurinol is the answer. Okay, and and we are going to now see a MCQ. Okay, so this is an assertion reason type of question. Okay, what is the assertion given here? The incidence of acute attacks of gout may increase during the early months of allopurinol therapy. That is, whenever there is acute gout, if you try to start therapy with allopurinol in the early months, okay, we started allopurinol in the early months. There is recurrent of acute gout. Okay, why there is recurrence of acute gout? Because the reason is there is a, when allopurinol is used, all the xanthine oxidase is inhibited, right? So there is less volume of uric acid in the body. In the pool, it is decreasing, right? So from all the tissue stores, this uric acid is mobilized when allopurinol therapy is started. So we will see a flare-up of symptoms when we start allopurinol initially. That's why allopurinol can be added with colchicine in the beginning days. Okay, so the answer for this question is yes, yes. Assertion is here right. Reason is also right, and reason gives a proper explanation to assertion. Agreed? Yes. And do we have any goals when we are giving this allopurinol therapy? What are our goals to be kept in mind while giving allopurinol therapy? Okay, we have one goal, to decrease the uric acid level. What is the uric acid level up to which we want to decrease in the serum? Okay, serum uric acid levels are to be decreased, right? Serum uric acid levels are to be decreased when we start with allopurinol therapy. This is our initial target, right? Our target is it should be less than 6 mg per deciliter. Okay, when there is no tophi but gout is there. Okay, but when there is gout with tophi formation, we can see in radiology, when there is tophi, our target will be lower. We should decrease the uric acid level further. Our target will be less than 5 mg per liter, right? What are the side effects of allopurinol? Most common side effect is hypersensitivity reaction. Okay, hypersensitive reaction. Okay, when does this hypersensitivity reactions occur? Then when allopurinol therapy is used in a patient immediately, yes, we may see immediately, but usually this allopurinol is popular for this hypersensitivity reaction, which can manifest even after months or years after starting of the therapy, even after months or years of therapy. This is the thing which we should remember about this allopurinol. Okay, and I told you, right, there is mobilization of tissue stores. Then what is the solution for this one? Allopurinol alone, when you give as monotherapy, we can see this mobilization of tissues, right? Tissue stores of uric acid. That's why add allopurinol with colchicine. As we know, our colchicine acts very aggressively to cause this anti-inflammatory thing. Okay, what is the other agent in this xanthine oxidase enzyme inhibitors? Febuxostat. Okay, febuxostat. What are the things which we should remember about this febuxostat? Yes, it is indicated for the condition of hyperuricemia. Okay, but for all the hypersomnia, will this febuxostat is used? No. When hyperuricemia is associated with gout, febuxostat is used. But when a person has hyperuricemia, but that same person do not have gout, then this febuxostat is not recommended. Okay, when the person is having hyperuricemia plus gout, febuxostat is indicated, right? But for that indication, when do we indicate febuxostat? For all the patients? No, this febuxostat is recommended for the patients who fail to receive this allopurinol therapy. Okay, for the patients who fail to respond with this allopurinol. When I tried with allopurinol, if the patient do not respond, then I will think of prescribing febuxostat, right? Okay, what is the beautiful point with this febuxostat? Yes, this febuxostat do not demand any dose adjustment when the person is having renal impairment. No dose adjustment is required for renal impairment. Okay, so this is how we think of whether to use febuxostat or allopurinol. When allopurinol do not work, go for febuxostat. Then why do we go for allopurinol as a first line? Why not febuxostat? Because febuxostat has its own of most common side effect is most common side effect of febuxostat is LFT abnormalities. Okay, but the rate of MI or stroke, which we can see as a side effect when we compare with this allopurinol use or febuxostat use, febuxostat has more rate of MI or stroke incidents than allopurinol. Okay, so allopurinol is safer than febuxostat. Then why should we think of febuxostat? Yes, we know, right? The efficacy of febuxostat is higher. Regarding the safety for this MIR stroke incidents, febuxostat is having more. So depending upon the situation of the patient, we have to decide to give febuxostat or allopurinol. Right? Understood? So in this video, we understood that lines of therapy for relieving pain and inflammation, and then how to inhibit the uric acid synthesis to decrease the pooling of uric acid synthesis. How can we act upon the increasing the uric acid excretion elimination? We will discuss in next video, right? So before going to next video, I expect you can answer this question. Yes, we know, right? This xanthine oxidase inhibitors, these are the first line of uric acid lowering therapy. Okay, right? What is the second line to decrease the uric acid levels in the body? Okay, we are going to discuss in the next video, right? Thank you. And for any queries, feel free to send an email at the rate of pharmanandan@zohomail.in. Okay, and for any queries, even you can write in the comment box below. Okay, or like at the comment and share this channel and subscribe to this channel. Okay, and if you want any further topic to be discussed in this channel, please feel free to mention in the comment box below. I will try to post the video as soon as possible. Okay, the topic which you like to discuss, you want a discussion on the topic, particular topic, we will try to post as early as possible. But before it, try to please subscribe and like this video. And thank you for watching. See you in the next video.